Invite Dr. JK. Enhance monofocals within kissing distance of multifocality. Dr. JK.
Yeah, this talking after Minu is very difficult. Is if not impossible. So coming to the EDOF lenses, why EDOF has come to the picture? Because for the ground around the world, say when I'm doing my post-graduation in 1989, 86 was the first multifocal introduced in the world, Pharmacia. It's called 811E. It's a diffractive multifocal, and they slowly depict. This is ECCE with the sutures. The market is around 4.5% to 5% of the sales. But what is the market now? Multifocal IOL, diffractive? No, in general, overall market. Yeah, 2.5% now. So from 5% it has come to 2.5%, and none of the IOLs introduced by premium companies and like Alcon, any other company, you name it, all they stopped manufacturing that particular model within 5 years. Either it's a restore. So here comes why they all closed down, why it came to the business now went to the monofocal, enhanced monofocal or EDOF lenses. Why it has come is what we are testing in the vision or whatever test in our clinic or in the laboratory, it's not matching the patient's visual needs. We just test Snellen's visual acuity and black and white letters. You put multiple letters and read it. That's not the world. People don't keep on reading black and white letters and move around the world. When they look at, we see N6 letters, but they don't see. They see a video in a mobile phone which has colors, which has moving. That's completely different from black and white E, B, C, D. Anybody can see, even just look like that, looks like a E. That's a different one. So whatever methods of Snellen's has come, they are only black and white. And whatever defocus curves, which are the hallmark, which are the standard method for assessing the multifocality of the IOL or any other extended depth of focus, all are letters only, black and white letters. And the latest benches which we use, the each power, pupil size, what is the power distribution in each pupil size, we measure different. We improved a little bit in the optical bench, but still it is one color. We select 540 nanometers when you are selecting the optical bench. We cannot select all the colors. We select only 540. That's somewhere between the blue and green. But the real world, you have green, gray, blue, red, all the colors. That is a big challenge. So there comes the extended depth of focus. As you know, spherical aberration, the peripheral rays will focus near, further, and aspheric, it will be in focus. In extended monofocal, what we do is we do extended negative spherical aberration. So the peripheral rays will focus farther instead of near, and the central rays will focus into the near point, little bit near point, so that when the pupil constricts, the center point will come into the focus, so it comes to the near vision. When the pupil dilates, when you are looking at the distance, the overall lens, it's not all the lens won't become, it's not accommodative. Overall, the power, overall energy distribution will be distant dominant. When the pupil constricts, it becomes 2 millimeters, it will become equal distributed in the near. That is the principle behind the extended monofocal or enhanced lenses. So to see the depth of focus, for example, these two pictures, you see it in my standard pictures you might have seen, both looks almost similar. But if you look it carefully, here, the second line, you don't see anything. Here you see it, you can see second line, you can see even the spring and everything. But overall contrast of the image on your right is very low when compared with the left. So that is the contrast sensitivity which people talk. It's no meaning at all in contrast sensitivity in real life. So you don't find any difference. And at the same time, you see the extended. For example, here you see it. This is the principle between the extended depth of focus. One of the first lenses introduced enhanced. Now every company is having lenses. They are equally good, and they are able to make it the same principle, that increasing the negative spherical aberration. There are a lot of calculations, there are a lot of methods to do that in manufacturing. Koenig constant method, there is a spherical aberration, there are a lot of pi square methods, but so one of them they use it in optical bench. So over that, the peripheral vision power is less than the central vision. So what happened, this became very successful, these lenses. So people now, They don't want the phobia and the bad repetition of multifocal lenses. They want to get rid of it. So they introduce the EDOF, extended monofocal or enhanced monofocal, they call it as. Now the companies want to capture that name and put multifocal IOLs into that segment. They want to use EDOF name because you cannot restrict the people using EDOF name by law. Anybody can put any lens EDOF. They are putting diffractive multifocal into EDOF, and they are labeling or refractive multifocals into EDOF. They are all EDOF now available or not negative spherical aberration lenses. Some are there, some are, for example, VVT, it is a refractive wavefront guided, wavefront optimized refractive lens, multiple segments, but they put it as EDOF. So why they did like that is because they are not able to sell as a multifocal. Already Europe multifocal gone. Diffractive multifocal they removed from the Europe, only available in US and Indian market. Within 5 years it will disappear. Within 5 years there will be no diffractive lens manufactured in India, or they sell it only leftover stock they are selling. After that it will, all companies will disappear. Already European market completely they stopped it. Only US market and Indian market they are selling the diffractive multifocals. Then comes the material. So the material, of course, you need a different materials will have different properties. So they reducing the material property main or is the reducing the chromatic aberration. So that is the one. So that chromatic aberration reduces because it's not black and white letters, but we are measuring with black and but life is not black and white letters. Another important thing is the AC. So some ophthalmologists thinks even 80 years, 70 years they should behave like a 20 years old person, but that's not the true. A heart, brain, anything, 80 years old person is different from a 20 years person. For us, 20, and 6, that's the same. Is a 20 years, 80 years, 100 years, he has to see 20, he has to see N6. Otherwise, that's a big challenge here. The number of cones will come down, rods will come down, processing capacity will come down. So it doesn't work in the same way as we expect these lenses. Why we are failing? So this is 2020. Happiness, unhappiness. He got a big talk. He can talk. Who is happy? Who is unhappy? That's a different issue. Happiness, unhappiness, nothing to do with the IOL. But who is the patients who waste your chair time most? Multifocal patients, not the monofocal or extended monofocal. So that is the biggest challenge around the world. And my simple question is, if you don't pay extra money, are you going to do multifocal IOL? If you don't get extra money for your surgery, per surgery, are you going to put a multifocal IOL or a monofocal IOL? That decides what is truly necessary for the patient. Extended monofocal is the future. Extended monofocal is the best option for the human eye, because multifocal, they failed for 30 years. When I started telling 85 onwards, they are trying companies. They are not able to increase even 1% of the business in multifocal. And so many lenses they changed. None of the lenses stayed more than 5 years. You take Restore, Technique, Synergy, Symphony, nothing stayed more than 5 years. 5 years they disappear. So what you do? If the patient comes, the lens was bad, they removed from the market. Same Apaswamy lens, PMMA lens, 30 years, same lens still selling 5 lakh lenses per month, they are manufacturing. So what is the best lens? Which gives least complaint? Do not waste your time. Counseling. What counseling you do it? Patient saying, I can't see. What you will do with that? That fellow, keep on talking. Don't waste your time. Enjoy your life. Thank you.